and all of a sudden it's like, wow, really?
Yeah.
You know,
Yeah.
so, man, interesting.
Well, you bring up an interesting point when you said about the 70s. So if you think about the 60s, 70s, and it was probably more radical in
Right.
regard to breast cancer once it was diagnosed, and what the treatment options, alternatives may have been, weren't
Yeah.
as, I guess, as you know, diverse as they are today.
Yeah.
Because when you were diagnosed with breast cancer during that period, it was some cases could have been even fatal.
Right.
Yeah, most often.
I think it's changed drastically.
Yeah.
Even from the time where I started my training till now, I think it's changed. But I think in those days, there were really a lot of options. You sort of had one option, and everyone sort of got the same therapy. And I think the cancers were diagnosed a lot later. But I think today, fortunately, we're able to offer women a lot of different options, and some of those are a lot less radical options that were offered back then. And actually, the survival is a lot better. I think we've improved. If you look at from the 1970s to now, the survival rate from breast cancer has improved. So we're actually doing better. I think we're doing better at catching the cancer. I think we're doing better at treating the cancer. So we've had some victories, but we still have a ways to go.
I can imagine, yeah. And you're located in Mechanicsburg, Pennsylvania, the
Yes.
Oakwood Center. You know, not to just sell Oakwood, but why would someone come to Oakwood as opposed to maybe going to another center? What kind of things do you guys offer there?
Well, I think the biggest thing is that we offer so many things under one roof. Okay. We could offer you the consultation services with the surgeon. We offer biopsy capability. In addition to the consultation with the surgeon, we also have the Oakwood Center and the Oakwood Breast Care Centers within the Oakwood Cancer Center. So within the Oakwood Cancer Center, we offer radiation therapy. We have physical therapists. So we have sort of a all-encompassing care, which is nice to do under one roof. And we help coordinate all that care. So it makes it easier for the patient once they enter our center to get all the information they need to coordinate all of their care, which I think is a great thing for a patient when they're going through cancer.
Yes, indeed.
You don't do mammograms there, do you?
Yes, we do.
Oh, you do mammograms.
We do
there.
mammograms.
Okay, so it is pretty extensive in regard to everything being pretty much under one roof.
You know, I would imagine that one of the things, and I know for sure that one of the things that is difficult about the whole disease of cancer, and then we talk about breast cancer, is you know, the psychological effect that it has, not only just on the patient, but on the family as well. So talk about that dimension and what, you know, people can do once they hear that diagnosis, they know they're going to deal with it. You know, what do you guys, as a doctor, what do you recommend?
Well, I think I always encourage people to lean on their support system, whether it be family, friends, their community, church. We do offer some support services through our center. There are a number of support groups in the community which I encourage people to get involved with. But I think as a patient hears a diagnosis and goes through the process, we just want to provide support for them, not only from a medical standpoint, but from a psychological, because we know typically it may take a while to treat them and get them through the process. And patients stay with us. I mean, we treat the patients, but we see them back again and again, and they continue to be part of the center. So, you know, we treat it as a family.
Yes, indeed.
That's one thing we talk about as a family. When you initially do the biopsy and you maybe have results that determine, in fact, that there may be some, you know, cancerous, lymph nodes or something there. Do you, when you have that individual come back in, more often women, than it would be men, do you suggest or request maybe their mate or partner come with them as you're discussing the options and alternatives?
Absolutely, absolutely. I think that's important to have that person there when you're having an initial discussion, because I think once you have the initial discussion, there's just so many things emotionally going through the head of the patient, so many things the physician has to explain, things you need to go over. That initial conversation, you may not be able to really tackle everything you need to tackle, but I think at that point you're at least providing information and sort of starting the basis of the care.
Prior to us coming on the show, you mentioned that you did a general surgery, and then you decided to move more into the specialty. What made you decide to look at this area?
I think there was a need. Where I was practicing, there was a need for someone to specialize in breast care, and I still think there's a need for that. And it just became a particular interest of mine and passion, and I've enjoyed it.
Yeah. Many people you know, have probably experienced someone in their family that has gone through this, and they may or may not be worried about it, you know.
Yeah.
And so what can people do in terms of just overall awareness, prevention? Should they be reading on something? Should they be doing, you know, just what should we do? We almost seem helpless when it comes down to cancer, you know? Yeah.
I think, I tend to think it has to do with overall health, making sure you get your yearly checkups with your physician. For women, obviously, it's a yearly mammogram and a checkup with their physician, a yearly breast exam. So I think just that overall health is important to catching these things, to making sure that we don't let things go too far in terms of not catching things at an early time.
Well, you know, my wife, she mentioned, okay, Pat just mentioned that she was, say, 40 when she really started getting with the
Mammograms.
mammograms. So how young should a woman be?
40, you
Okay.
start annual age 40. You can start earlier if there's a significant family history or some other factors, but the recommendations now are starting age 40, annual mammogram, and also an annual breast exam, okay? Either by your primary care physician or OBGYN or someone who's qualified to do the exam.
So you've not seen young people then, someone teenager, 20s?
Unfortunately, I have seen actually patients in their late teens with breast cancer, although it's quite rare. You know, most women with breast cancer are over the age of 40. But, and I think, again, it has to do a lot with the patient's family history, their risk factors. Some patients may have higher risk factors than other patients, although they may be younger. So I think that's important to discuss that with your physician.
Okay. Ethnicity, does that play a role at all? Different ethnic groups seem to have a higher, you know, propensity of cancer or not, or no?
Yes, they do. In terms of, specifically in terms of breast cancer, if you look at, you know, African Americans versus whites, whites tend to get more breast cancer, but African Americans tend to die more from the cancer.
Wow.
Oh.
Okay.
So the question is, why is that? I think it has something to do with genetics, which is being researched, types of cancer, the biology behind the cancer, and some thought that maybe the cancers may be diagnosed a little bit later stage, so they're more difficult to treat. So I think there's a lot of ongoing research about that, but unfortunately, those numbers haven't improved dramatically.
That's amazing, fascinating, yeah.
Does that tend to, if you look across just, you know, internationally in the world, does that pretty much hold true for people of color or people of African descent, or are they Middle Easterners or other individuals that tend to have propensity to it?
I think, I'm not entirely sure, but I think the idea of the Western kind of lifestyle, the Western diet, may have something to do with it. For instance, if you take someone from Africa, for instance, and you put them in the United States and they live here for a time, I think their risk profile changes. And I think that may have to do with the sort of Western way that we do things, which has a lot to do with our diet and exercise and things of that nature. So it's not really clear, but I think the Western sort of way of living probably has a lot to do with the risk factors for breast cancer, at least.
Yeah, more saturated foods, less exercise, that kind of thing.
And maybe stress.
And stress too.
Right.
Yeah, that's too.
Yeah.
You know, the other thing is with the unfortunate, you know, disaster in Japan, it brought up that whole notion about radiation again, and the you know, plants and stuff. So environmental influences on our health, and even when we're talking about breast cancer, are there factors? And I know you said you're not quite sure, but have you noticed that people that live in a more industrial, you know, society have a more, you know, incidence of cancer, flat-out cancer diagnosis?
I think it depends on the type of cancer. There are some environmental things in terms of industrial things, chemicals, exposures that predispose you to increased risk for different types of cancer. There's environmental things such as, indirect things such as if you live in an environment where you have high crime, if you have poor schools, if you have poor nutrition. I mean, all those things sort of weave together to sort of paint an overall picture of people's risk for development of cancer.
It's sad but true, huh?
It's
Yeah,
sad.
unfortunately.
It is. And that's why we always say that, and it seems like the waste dumps in places where they, you know, dispose of things is always in the lower income, at least that's they keep talking about lower income areas, because, you know, the more middle class or the more affluent, that's, no, you're not going to bring that here.
Absolutely.
But the other ones, they don't fight
That's
it, and then
absolutely true.
just some, okay. Wow, wow. So